Coronavirus has mutated into 30 strains and the one ravaging Europe is more deadly than the US strain, Chinese study finds. The novel coronavirus has mutated into at least 30 different strains, which could have very deadly complications for the pandemic, a new small study finds. A team of Chinese researchers from Zhejiang University say there are tens of strains of the virus, known as SARS-CoV-2. Strains within China were some of the most dangerous and resembled ones that spread across Europe, reported the South China Morning Post. Meanwhile, the weaker strains appeared to largely congregate within the US. The authors say their findings are the first to show that the mutation could affect the severity of illness. It comes on the heels of a report that America was hit with strains of the coronavirus from both Europe and China. For the study, published on the preprint service medarchive.org on Sunday, the team analyzed viral strains from 11 Chinese coronavirus patients. The Post reported that next, they tested how effectively the virus could infect and kill human cells. Surprisingly, the team found some of the deadliest mutations in Zhejiang, where the university is located. These mutations had also been seen in several hard-hit European countries such as Italy and Spain before spreading to the US epicenter New York. Additionally, the most aggressive strains could create up to 270 times as much viral load as the least potent type. However, some of the milder mutations were the varieties largely found in the US, including Washington state, which could be the strain that shut down Wuhan, where the virus originated. SARS-CoV-2 has acquired mutations capable of substantially changing its pathogenicity, the authors wrote, according to the Post. The researchers warned that just because the mutations were milder, it didn't mean there was a low risk of mortality. 2 patients in Zhejiang, one in their 30s and one in their 50s, became severely ill after contracting weaker strains. Although both recovered, the elder patient required treatment in a hospital's intensive care unit. Researchers detected about 30 mutations in total. About 60% of them, or 19, were new. The authors say that patients with COVID-19, the disease caused by the virus, have been receiving the same treatment at hospital regardless of what strain they have. They say that strains may need different efforts to fight the virus. Drug and vaccine development, while urgent, need to take the impact of these accumulating mutations into account to avoid potential pitfalls, the researchers said. Worldwide, more than 2.45 million people have been infected and more than 168,000 people have died. In the US, there are more than 771,000 confirmed cases of the virus and more than 41,000 deaths.